Hello everyone, welcome to today's broadcast, Understanding Container Closure Integrity Test Failures. I'm Meg Rivers, Senior Editor for the Pharmaceutical Technology Group, and I'll be your moderator for today's event. This webcast is presented by Pharmaceutical Technology and sponsored by Nelson Labs. Here is a quick statement from our sponsor. Nelson Labs, a Sotera Health company, is an industry-leading global provider of lab testing and expert consulting services, performing microbiological and analytical laboratory tests across the medical device, pharmaceutical, and tissue industries. With the addition of Nelson Labs Europe, the company offers a global extractables and leachables lab testing platform. Nelson Labs has more than 500 scientists, technicians, and service specialists performing more than 800 rigorous tests in 14 global laboratory locations. Now, before we begin, let's run through a few housekeeping things. This webcast is designed to be interactive, and we encourage you to ask questions during the event. You can submit questions by typing them in the Q&A box, which can be found at the bottom of the video player. To enlarge the slide window, click on the small icon in the bottom right corner of the media player. The slides will advance automatically during the event. And if you have any technical problems viewing or hearing this presentation, please click on the question mark help widget in the top right of your presentation window. Without further ado, I'd like to introduce today's speakers. I'm joined by Jennifer and Logan of Nelson Labs. Jennifer has more than 25 years of medical device laboratory experience. She has worked in microbiology, bioburden, IDs, and packaging at Nelson Labs and has experience with various microbial tests, including microbial limits, plate counts, biological indicator population verification, organism ID tests, and bioburden tests. Logan holds a degree in microbiology and has most recently taken on the role of Laboratory Operations Manager at Nelson Labs. He has worked in the sterilization, IDs, and packaging departments. Logan has extensive knowledge in the packaging section as he has aided many customers with their package testing needs, from the benchtop to troubleshooting and validation design. Thank you so much for joining us today. Now I will turn it over to our first speaker.
Well, thanks for that introduction. Today's webinar is Guidance on Understanding CCIT Failures, or when a failure isn't really a leak. And we really put this together with a bunch of different examples that we've noticed over the years of interesting things that can cause a failure, but that may not really be a failure. And we put this together because anytime somebody hears the word failure, it just incites this natural panic reaction in us. And we want to give you a little breathing space so you can step back, take a deep breath, and investigate before you panic, to keep calm and carry on, because not all failures are actually an indication that you have a true problem. Let's go through and start with a little background on CCIT. And if you need more information, we do have some great content on our Sotera Health Academy that I'll mention again at the end. We've got a webinar that goes into a lot more detail about how mass extraction works. That's kind of where all these examples are being taken from. And we also have another webinar that I did on the different container closure integrity methods that are listed in USP 1207. So if you need some more information, you can go look at those. But for today's purposes, just to kind of give you a refresher or background, CCIT testing, or container closure integrity testing, is really just a test to make sure the containers are properly sealed and that they're not leaking any more than intended, because everything will leak to some degree. We're using this test to verify that the package integrity is there so that we know that that container will maintain sterility of whatever's inside. CCIT methods are divided into two categories. One is deterministic, and those are the fancy ones that use the equipment that measures something. They're very sensitive, they're non-destructive, and they're really the preferred methods. The probabilistic methods are going to be your methods where somebody is using some kind of a subjective measurement. Usually it's a visual to see if there's growth or there's dye detected or things like that. When we're looking at these deterministic methods, which is what we're focusing on here because those are the preferred ones, they fall into two basic categories, vacuum-based or detector-based. And the vacuum-based examples of that are mass extraction, vacuum pressure decay, helium leak. These are all vacuum-based methods. Now, high voltage leak detection and laser headspace, those are detector-based methods. And in this webinar, we're giving you examples based on mass extraction because that's the deterministic CCIT test that we run here at Nelson Labs. But these principles are going to be transferable to some of these other methods as well. Just to give you a basic test description about what the method is going to look like, it's going to start with some custom fixtures. On a vacuum-based method, these are going to be vacuum chambers with different fillers to make sure that we occupy all the free space that's in the chamber. If it's a laser headspace or high voltage leak detection, those custom fixtures are holding the sample so that it's positioned exactly in front of the detector to make a good measurement. The next piece is that we need to do some kind of sample prep, either to get a baseline on the instrument or get things ready. And I'll show you what the prep looks like with mass extraction. And then the machine, once it's had that stabilization or preparation phase, it's going to take a measurement and then compare that measurement to a pre-existing set pass-fail and give us an indication of whether or not we've passed or failed. Here I have an example of some typical CCI graph data for mass extraction. You can see from this graph here that I have a line that's going along my time interval. I have a few peaks on there. These are a couple preliminary leak checks that are done by the instrument. And there's this long flat that ends at about 42 seconds. That's my sample prep. This is about evacuating all the air and getting the system stable in order to take that final leak measurement. And then what you see from 42 seconds on is my final leak measurement. I've got a line right here. This is the curve, this green one here, for my 2-micron defect. My 2-micron defect is a calibrated leak orifice that I'm going to run with every data set to give you an idea of what the flow rate is in this test system for a defect of a known size. And this method is using 2 microns. My next piece here is this pass-fail threshold, which is set at about 5.5. And that's the magic number that the computer is comparing the measured flow to determine if it's a pass or fail test. And then down here, I have my non-leaking or my good samples. And you can see down in this very bottom section, I have a really, really dark line. I have a lot of overlap with samples very, very near to 1 or to 0. And then I have a few that are just one here that's almost 3, and I have a few that are between 1 and 2. Those are my non-leaking samples. All right. When somebody wants to know, and I get this question a lot, I have this sample, is it going to be compatible with mass extraction? This is my thought process for looking into whether or not the sample is going to be suitable with one of our methods. The first thing is I'm going to look at it, try and figure out what fixturing options we have, put it together, and try and run a method. If I can get that method to run to completion, great, I can move on. If I can't get the method to run to completion, sometimes there's things I can do with changing the fixturing that might get the method to be able to go to completion together. Once I have a working system set up and I have a working method that I can run to completion, the next thing to look at is, are my values uniform? And if we go back here, you can see that I'm hoping to have all of these values somewhat similar or uniform in nature. But again, they're not always going to be the same. But if they're not similar, that's an indication that I don't have good process control. And really, really sensitive method isn't going to work unless I have uniformly sealed containers. Once I've established that my flow values are pretty consistent, then I need to look at the difference between leaking and non-leaking flow rates. And here I should have a cluster of lower numbers that are my non-leaking and a cluster of higher numbers that are my simulated defect. And if I have a good separation there, then I should be able to draw a line in the middle. That's my pass-fail. If I have overlap between those two groups, then I probably need a different method, something that's going to give me a better separation so I can tell the difference. And then the last step or hurdle I need to overcome to make this work is to make sure that my controls are in range. My positive control needs to fail the test. My negative controls need to pass the test. And again, that's all about having the pass-fail threshold in the right spot. Just to give you a visual graph of what this kind of looks like, here I have some non-leaking parts. This is day one for a method qualification that we did. And you can see that they all ran to completion. I have measured values. So hurdle number one is accomplished. I have pretty consistent flow. If you look at these values here, you'll see that the gap here in this box and whisker plot is pretty small. And this is the same sample set run on day one, day two, day three, 3 different analysts. And it's pretty good, pretty similar. Same thing with my simulated defect. I've turned my CLO on here to give me a flow rate for a 2 micron in the system. And again, I have pretty nice consistent data. And you can really see it here in this larger graph where I have put the two together. So hurdle 2 is accomplished, I have consistent data, and hurdle 3 is well demonstrated in this graph. Look right down here, those are my good ones. Here's my simulated defects. I have a lot of space in between here to set a good pass-fail threshold. So that is hurdle number 3, and then hurdle number 4 would be accomplished by showing that my controls are going to pass. I have a little story here to tell you about something weird that is going on in my neighborhood. Something happened in 2011 and everybody decided to have kids. We actually had 9 kids on my street born that year. Every other age group has maybe 0 or 1 or maybe even 2, but there were 9 kids in this age group. And one of them, he's really short. And it's not surprising because his dad is just a little over 5 feet and his grandma was 4 foot something. He's short because he inherited some short genes. And if you take all of the kids at my elementary school that are in the 6th grade and you line them all up, then my little friend here is going to he's going to look like an outlier because he's so much shorter than the average height of 6th grader at the elementary school. And so I would look at him as this outlier until I reframe what I'm looking at and I just look at the population on my street, which is a subset of the kids that go to the elementary school. And there's something else interesting going on, and that's that every one of those kids is on the bottom half of the scale. So they're below average height. And coincidentally, I only have 7 kids right now. 2 of them moved away. The 2 that moved away were really tall. So I have an abnormal population, and it's nothing funky that's going on with the water supply or anything. It's just coincidentally, every kid that age happens to have parents that are kind of short. And I bring this up to illustrate the theme of this is that you need to be using the right measuring stick. Sometimes we have an instance where we get a sample, it looks visually like it should work, it looks just like other ones that we've tested, but there's something unique about it that may not be readily apparent that makes it different from the population that we validated when we created the method. And so a lot of these failure modes that we're going to go through are really related to not using the right measuring stick because these numbers that we have in these methods, they're all relative based on whatever population we used in the validation. Here's a few things that can affect that final flow value. And if you change these up, these are going to give you different outcomes. And I've got some data to kind of show that here in just a second. On my first picture here, this is my vial chamber. Depending on which chamber I use, I can get some different flow values. because I've changed my setup. This next picture here, these are fillers that would go in this file chamber. And again, this really relates to the concept of free space, how much free space is in there, or how tight is my sample within the chamber. And then the third thing, which also relates to free space, is this. These are my masters. These are solid aluminum parts that we know don't have any leaks, that we're using as a control. This is going to be my negative control for the test. And if I don't have a master that's very representative, if I use a larger or smaller one, it's going to change my flow values. And then the last two here that I have are my method. And this is an example of one of the methods that we're looking at here. And really the sequence of events, I can't change that, but I can change the amount of time that the machine spends in each one of these, and I can change the limit values. And just adding some time or subtracting some time from a step will make a difference, as I'll show you in a minute. And then this last picture here, this is our calibrated leak orifice. We have methods that have been developed around 2 microns, and we have other methods that have been developed around 5 microns, and those methods will yield very different flow results for the same samples. All right, let's look at some data. Right here, I have 2 different types of samples. One is a syringe, one is a small vial. So this is a different chamber setup for 2 different types of samples on the same method. Or actually, sorry, I messed that up. This is the same sample on 2 different methods. So one of these methods is a syringe method. The other one is a vial method. It's the same sample on both. So the only difference is that one of these methods has a longer evacuation time in the first evacuation step. What we'll see here is that the average final flow is lower in these 2 sets just because I have increased that evacuation time. It went from just over 3 in this first set to just under 3 in the second set. Same exact sample, same exact fixturing, only difference is the method has been slightly altered to change the timing on 1 step. Here's another example, and this one, I have a single method, but I am using 2 different setups. The first group here is a syringe sample with a syringe fixture, and the second group here is the vial in a vial fixture. So same method, 2 different sample types. You can see here my light blue, this is the non-leaking, and the dark blue is the simulated defect. And I can tell by looking at these 2 bars that there is quite a bit of difference between the non-leaking and the simulated defect. So that's pretty good. This is just average value, so I can't see how tight the data is, but I look like I have good separation here. And then this red line here is the pass-fail for that method, which again is about 5.5. Something interesting to look at is that all the vial numbers are slightly lower than the syringe numbers. Again, the flow has been changed because I have effectively changed my free space by using a different fixturing setup. And if you look here in the vial numbers, I have quite a bit of space. In fact, this line seems to be pretty even between, a good part and a bad part. But when I look over at the syringe, my good parts are much closer to failing than they would be using this other one. And so you can tell that this method was actually set up using a vial sample, and we've tried to put a syringe sample in there. Still works with the method, but I have a little less breathing room when it comes to false failures. Speaking of failures, Logan, how about you go through a few common failure examples and let us know some interesting things that you've found out.
Yeah, and we've seen some interesting things through the years as we become more familiar with these methods. And kind of like you said at the beginning, Jen, whenever we see something fail, we don't want to freak out.
No panicking.
So we have put into place a way for us to know and be more confident in whether or not something is actually failing. So we have a test number for it. and we're going to test it. We run it through the method, and lo and behold, it fails. So what do we do from this point on? Well, we'll take that master, that perfect aluminum part that won't leak, and we'll run that just to get the system back in spec. We'll wait some time to let the sample re-equilibrate, and then we'll run a confirmation test on it. And lo and behold, that sample fails again. So now we've got two failing results for the same sample. So we've got good confidence that that failure was truly a failure. But we can, while we're in between that first and second run, we're looking at the setup, we're looking for any abnormalities as well. So what can also happen though is that we run the test article, we failed, run the master, wait our time, run the first confirmation test, and it can pass. We'll go through this same process again. We'll run it a second time. We will even run it a third time. And if we manage to get 3 passing results, that can help us overturn the original failure and provide evidence to us that that first failure wasn't actually a failure. So to introduce some of these failure modes that I'll talk about, I want to play the game Spot the Difference. Here's the fresh, young picture of me when I first started working here at Nelson Labs. And then on the right, you have a more current photo. So I'm obviously wearing a different shirt. I learned how to smile with my teeth. But the biggest thing that you might notice is that there's more hair on my head than there used to be. So let's talk about this first. Can any of you see what's on the chamber right here? If you look close enough, you'll see that there is a hair. And so this is what the chamber looks like if the lid is off. And that O-ring, that gasket, is meant to create a tight seal on there. But if we do get debris on that seal, something preventing a good seal, like hair, for instance, then that could lead to a failure. That's not actually a failure. So that could be one of the things that we're checking for when we're going to do our confirmation testing. Similarly, I want to show you, this is that same chamber, except now the lid is on. This is the chamber where the lid is seated properly. It's nice and snug on the chamber there. And do you notice what's different about this one? This is a little exaggerated. We wouldn't see the lid that off the chamber. But there are some things that could interfere. If a sample might just be a little bit too tall, or if it's not seated properly inside the chamber, there could be just barely not enough clearance that when we go to put the lid on and we run the test, it may not be snug, and so you can't get that seal. That will obviously lead to a so those are some that talk about the setup of the test, but let's start talking about some test articles that might have some failures. I have just some screw cap bottles that I want to use to highlight the point. You can see the bottle on the right is very clearly snug, and the one on the left has a lot more room that we could take. If we're testing these kinds of bottles, or if someone chooses to use these bottles, you're really relying on a couple of things in order to ensure a tight closure. You want to make sure that there's very little space between the threading, or that the mating surface between the bottle and the lid is tight enough that it will create a good enough seal. So with that in mind, I want to move on to show you some data. On the right, I have an example of a screw cap bottle that you may be familiar with. And on the left, I have a data set where these kinds of vials were being tested. And if, once again, pay attention to that red line, that means our pass-fail threshold. We're getting a lot of great passing results, but then once we hit sample 24, that final flow value is shot straight up. It's nowhere close to passing. And when we pulled this sample out of the chamber, we saw that it was actually leaking a little bit. We sent this sample away to be investigated a little bit further, and one of the things that came back was this sample hadn't actually been tightened to the specification that was required. We did a little bit more testing on that one. We torqued it to the appropriate specification. We ran it again, and we were able to pass. And this was actually really helpful because this helped identify a problem in this capping process that was made apparent by seeing this failure. So if the cap is on tight enough, it can certainly pass the test. But if it's not screwed tight enough, torqued to the specification that's needed, you might find some of these failures. So moving on, I also want to talk about label compatibility. So your vial, it may have some labels on it. And what we've seen is that some labels will off-gas and interfere with the test system. Others won't. So one of the first checks that we do is to make sure that the label is appropriate for the test. On the left, you'll see set 1 and set 2. Don't let set 1 fool you. That one actually failed the label compatibility, because if you follow it over there, the labels were off-gassing so intensely that they failed at the large leak check. That was one of those first leak checks that Jen showed you on that graph, the 2 at the beginning. And we only get a final flow value, which I can report out to you in a graph here, if we make it to the final leak check. If you compare for set 2, the light blue bar is with labels on, and you can very clearly see that it's failing. It's well above the failing threshold. But when we took the labels off, it's passing with flying colors. So it's important to understand whether or not your labels will interact negatively with the test system. All right, so I want to show you some more pictures. I've got a vial here, and this vial, it used to have a label there. You can see there's some gunk left over, and if we try and clean that gunk off, sometimes what happens is you can even get some residue. So not only can the label and test system, but also this residue that gets left behind may also give you failures that aren't actually indicative of how your closure system is actually performing. So I'm going to show you a data set here, and for this event, what we had is we had some vials that very clearly failed with the labels on. So we removed the labels, we cleaned them up, and the chemicals that we used to clean them, we wiped them up, we put them back in the box, and they stayed there until we went back to test them. When we tested them, I've got a little asterisk there next to sample 1 and sample 3. That's where I couldn't get my final flow value because it failed early enough in the process. It didn't go to completion. What we discovered was that there was not enough time given to allow the residue to completely evaporate away. So you can see this trend of the beginning samples that we test. We're failing, it's all over the place. But then by the time you get to about 25-ish is where you're really starting to see some consistency in your data set. So once again, this was not a failure that was as a result of any sort of leak that the closure system had. There was just some residue on the samples that were messing with the test system. One more thing that we want to talk about is so we have an auto injector, and auto injectors, they can typically be stored in the fridge. And here's a picture of one if you've never seen one. But usually you've got your syringe, and that's housed in some sort of plastic casing. You've got your window that you can look inside, and then at the bottom is usually the safety cap where it won't fire unless it's pressed down. And one of the things that we see is that when you bring these auto injectors to room temperature, so we can actually test them, you can start getting condensation within the auto injector, and sometimes that plastic housing will actually trap it, and it won't actually evaporate very easily. And that's a problem if we're running it in the test, because any moisture in there will likely be picked up by the equipment. So there are a few things that we could do to try and overcome this problem. The first thing that we could do is we could add a heating step. That may not be ideal, because if you heat it up, who knows what it can do to your closure system. That might be a risk that you're not taking. You could consider just having a longer dry time, letting it sit out on the bench for however long you chose before, right? But if we got a lot of tests to run, and so maybe that might not be an ideal option either. Ultimately, though, what opted as the best option was to add a desiccator step. So you've got a desiccator right there. You fill it up with some desiccant, and that desiccant will just absorb all the moisture as the auto injectors are sitting in there. That'll hopefully save some time. It won't interact negatively with your auto injector, and you'll be able to test it.
All right. So a couple last points to put in here that I'd like to add, and one is about free space. So I did discuss about how changing the amount of free space will affect your final flows, and here I have some data to really highlight how this looks. This picture right here, this first picture, is my auto injector chamber with just an empty filler in it. So I have this big block of open space here, and that's what we call filler D, because it's the fourth filler we have. And you can see there what my final flow is in this method. Now, I took these little shims that we have, they're little aluminum shims, and they're about 1/8 of an inch deep, and I added 1 bar. And look, my value goes up. I added 2, 3, 4. My values continue to increase as I add more filler, which is then taking away the free space. And then right here at 7 bars, I'm up to the same level as the top of this filler, and that's as full as this can get. But then I have this cavity right here, and so I added in a master to kind of try and fill that area up. And you can see that filling that area made a significant jump in my final flow. Just to kind of give you an idea, again, of how the fixturing can affect whether or not you pass or fail. Let's say that 20 was your pass-fail number. Well, you can see that I could be over it or below it, just depending on how I've set my test system up. And here's another example of that. Right here, I have this first set of data here that we want to look at. This is some new samples that came in, and they wanted us to evaluate whether or not they were going to work. And when I ran the samples by themselves, I got my good flow right here in the first block, and then I ran my CLO and my master, which it would be my positive control, and it looks like I've got a good difference. I also tried to run the sample with the CLO on, and that's what this green bar is the defect. And then I've got this orange bar here, which is my pass-fail. This one is going to pass hurdle 1. Okay, the method runs to completion. I'm going to pass hurdle 2. I'm going to get distinct difference between good and bad parts, and my parts are going to, the values were very consistent. So that's hurdle 2, that's hurdle 3, and then we get to hurdle 4. And that's where I ran into a problem, because right here you see that my pass-fail is almost even with the sample with the CLO on, which meant that I was right on the fringe of having this method work. But then I have a problem, because this blue bar here is actually the control that I will use, and this control is not going to fail, and that's supposed to be my positive control. This has a little interesting fixturing problem, because I'm getting a pretty big discrepancy between my actual control and my simulated control, which is not very, very good. And I got a little picture in a second to show you on that. But the solution to this one was to go through. We found all of everything was going good until the fourth hurdle, and we solved this by creating a custom method. And if you look at the second group of data right here, you'll see that it's the same exact data. Everything's the same except for the orange bar. All we did was go through and run a custom qualification where we gathered data for essentially this good part and this good part with the defect on, and then use that to calculate an appropriate pass-fail value that now is below where that control is going to be, but still sufficiently high that it's between passing and failing. And just to kind of highlight again the problem that we were seeing there, it's about improper master selection, where I have that difference between my master plus CLO and my sample plus CLO, and I'll show you why that happened. I need a master that's as close in volume and shape as possible to minimize free space. And here I have an example of one vial and 3 different option types. And if I look at this, I think that the one on the left is obviously visually closer. And so that's the one I think I need to select. And in most cases I would, unless for some reason I can't. Let's say that the diameter is just slightly different, and it doesn't work that I can get the master to the left to fit into the chamber. And so maybe I have to go with the smaller one in order to get it to fit. Well, if I put the smaller one into the same size filler, you can see that while the glass vials fill this, I have a lot of extra space in there. And that's where you're going to get a discrepancy between, like you saw in the first example. Just to show you, this is the setup that we used. And there's a second piece to this filler that will go on top of this. It looks pretty well filled, except I have a bit of space around all of these master parts. And you can tell from the filler that this sample is actually tube shape. And if I had a master like this one that was shaped like a tube that fit perfectly in here as the samples do, then I wouldn't have had as much free space, and I would have had values for my master and CLO that were very equivalent to my product. And then one last interesting thing about this test, and this would really apply to all vacuum-based methods, but they're a little bit dependent on altitude. We had an instance where we found this out during our validation, because we get the equipment from a vendor in the middle of the country, they're close to sea level. We had it transferred to our facility, and a few of the numbers didn't match, and they had to recalculate things based on the change in altitude to get the validation to complete. And then we've had an example where we were trying to do a method transfer. This method was created at sea level, and it was run by another lab. Then it was transferred to Nelson. We're at about 4,300 feet above sea level. We're in the Rocky Mountains, which is very, very nice, but it does create a bit of a discrepancy. And when the samples were tested in our lab, we were getting much higher flow values. And again, those flow values were very close to the pass-fail threshold that was set for the method at the lower altitude. And they didn't have this problem because at the lower altitude, there was a lot of separation. But our non-leaking and our leaking were both higher, kind of like the example that I had at the very first. And so there's something to keep in mind when transferring methods over. And then it kind of work on trying to wrap things up a bit. Let's go back to our process here for determining the method completion. Sometimes I may run into some issues, and we've shown you a number of examples here where things just don't seem to fit right. And I may be getting failures, and those failures may be due to not using the right measuring stick. If we remember my friend up the street, if I compare him to his peers at the elementary school, which again is my larger neighborhood, he's going to look like a big outlier. But if I compare him to the smaller subset of just the kids on my street, yeah, he's still short, but he looks much less of an outlier because the other peers in that smaller sample set are more closely related to him. And in cases where you think that you're kind of nearing the line, we do have an option for you, and that's to qualify your existing method with our setups. Maybe you'll find that your sample is a lot closer to that pass-fail, you know, and that maybe you're not using the right measuring stick, and even though we can use that method, maybe it's not the most appropriate. Or maybe you'll find that you are perfectly lined up with the set that was used to create that data set. Oh, wrong direction. The other option is if you're having trouble getting the method to run to completion, and you've tried different fixturing options, and maybe you are close to getting one of these other methods to work, you can always create a custom method. Again, we showed an example where we created a custom method, same exact method, all we did was change the pass criteria. We can also create a custom method that changes the timing on one of the steps, and we showed how changing the timing on a step can affect the final flow values to move them up or down. And we've also shown how adjusting fixturing to reduce or add free space will move those final flow values up or down. And we've seen a number of people looking for this kind of information as well to make sure that they don't have an instance with a method transfer anomaly where they're getting something different. So they want it specifically with their own sample. And so just to wrap things up here, this is my contact information, Logan's contact information, if you have any questions that you'd like to send to us. And this is the Sotera Health Academy slide that I promised. It's a great repository of all of our learning and knowledge that we put out there. There's webinars, there's white papers, some ebooks, and it's all wonderfully searchable. So you can sign up for free, get access to all this kind of content, and you can find what you're looking for very easily through the search. And then finally, last little bit here is that Nelson Labs is part of a larger family. We're under the Sotera Health umbrella, which includes Nelson Labs, our friend Sterigenics, who do sterilization, and Norion, who makes sterilization. And so we've come to the end of the webinar. I hope that you found this interesting and informative, and that it will help you to really view container closure integrity and specifically failures in a new light. So if you're looking at starting testing with container closure integrity, you're trying to qualify a method or select a method, or if you've been doing it for a while and suddenly you have some strange failures, that you'll look back at this information and make sure that you're using the right yardstick, because again, these numbers are really all relative, and it depends on how you relate again to the population that was used to establish the pass-fail threshold for the method. So I think at this point we'd like to turn it over and see if you have any questions that you would like Logan or I to answer.
Thank you for sharing your insight in this presentation. For the audience, before we move to the Q&A, if you haven't already, you can submit questions by typing them in the Q&A box, which can be found on the right-hand side of the presentation window. Okay, let's just jump into the questions. Our first one is, what is the y-axis representing on this graph? There is no unit.
Sorry, we forgot to put that on there. The equipment measures micrograms per minute. That would have been the y-axis on all of our graphs.
So that's what the flow values for the tests come out in, it's the units.
Great. Let's move to our next question, which is what USP or any other method does Nelson Labs use for CCIT?
Well, of course, we do reference USP 1207. That's the USP method for container closure integrity. However, that particular standard doesn't explain how to run any of these tests. It just talks about container closure integrity concepts. And most of the test methods are actually run through ASTM standards. The ASTM standard for mass extraction is F3287. And there's one for vacuum decay. There's one in process for high voltage leak detection. So there's various standards through ASTM that will dictate how you would run the individual methods, and USP 1207 is more of a overarching standard to talk about container closure integrity concepts. So we would reference both of those in our STP, or standard test procedure, but we're actually following the ASTM F3287 when we perform the mass extraction test.
Great, thank you. Next question is related to slide 11. The person says it looks like testing into compliance. How do you justify repeating a test 3 times without having a probable root cause for a failure or some kind of investigation first?
That's a very good question. And that question gets asked by a lot of sponsors and by QA departments all over. And that's part of the reason why we put this webinar together, is to really kind of explain a little bit that failures in the test aren't always really failures with the product, to give people an idea of the broader perspective, to look at things outside the box and figure out if maybe you're not using the right measuring stick or you've got something else going on. As far as that confirmation testing procedure that we have, it is proceduralized. And when you set forth what you're going to do in the case of a failure, and you document that that's what you're going to do and that's what you follow, it's not really testing into compliance. We have a troubleshooting flowchart in our procedure that we'll follow, that will go through the most common failure modes that we see that aren't related to testing. Logan showed the example of the hair or the debris and the lid not being on properly. There are a number of things in that flowchart that they'll need to go and look at. They'll need to check and make sure they don't see any debris. They'll need to clean the gasket. They'll need to re-grease it. They may need to clean the fixtures and bake the fixtures in case there's some residual mass coming off of that, and clean things up. And then they'll have to run the master to make sure that the system is operating normally with the controlled value, and then they would retest. So there is a written process for doing that we follow to ensure that we can show that we're not testing into compliance. We're not randomly repeating testing. We have a very rigid process that we follow step by step in order to confirm that the data that we have is in fact a true value. And as he showed in his diagram, if the confirmation testing shows that it's failing, then we would report that as a failure. It's only if we have substantiating evidence showing that something has happened during the test, where we have the 3 positive retests on the same sample, that we could use that information to overturn. And generally there is something that's found in that troubleshooting guide along the way that would let us know what the problem was that gave us that erroneous result.
Great, thank you so much. Next question is, what sensitivity is recommended to test to?
Yeah, so there's not really a recommendation in any published documents that say, you know, you have to test to this level of sensitivity. The more sensitive, the stronger case you have that your product is showing good container closure integrity. We have routinely seen the number 20 microns being thrown around as a number. But since mass extraction is such a sensitive method and can go down to 2 or 5, we typically prefer to test at those more sensitive.
Yeah, and that's an interesting question because all these deterministic container closure integrity methods are capable of 10 microns or less, and you can get the sensitivity down depending on how much you maximize, optimize, or customize your test setups and your methods. But again, what's the magic sensitivity that you need to hit? The only number we've seen thrown out there is 20 microns. And so any of these deterministic methods are well below that sensitivity. And we do have some samples. Right now, currently, we have some 2 micron based methods. We have some 5 micron based methods. We're working at getting a 10 or a 20 micron based method developed. But what will happen is samples will come in and we'll just default to try out our 2 micron methods with them. And if they don't work well, we have trouble getting them to run to completion or something like that, then we'll move to those 5 micron methods and see if it would work better with a different method. And we anticipate we would do that in the future, also going up to a 10 or a 20. So really the method sensitivity is going to be case specific. How sensitive do you need to be? And generally people will try to fit into the most sensitive test method that they can get. As long as it's under 20 microns, you should be okay.
Great, thank you. Our next question is, should I switch from blue dye immersion to a deterministic method?
So yeah, the blue dye test, the dye immersion test method has kind of been the industry standard for a long time.
Even though it's not standard. There's no compendial method to tell you how to run that.
No one tells you how to do it, but that's what we've been doing for a long time. But this goes back to the slide where Jen was talking about probabilistic versus deterministic. And really with all these deterministic methods coming out, the industry is shifting away from that blue dye test towards one of these deterministic methods like mass extraction. You might even start seeing some pushback asking the question why you haven't switched over to a deterministic method. So we would highly recommend strongly considering switching to a deterministic method if you haven't already done so.
Well, it's funny you should mention that because we started seeing some pushback. The new USP 1207 published, and then there was a certain number of years. They always give you a few years to make your way into compliance because you can't do these things overnight. But after a certain number of years, all of a sudden we had a rash of FDA responses that came through about the blue dye test. And then COVID hit, and it's been quiet. But I would suspect that that's going to pick up now that the FDA is back out in force and that we've kind of, I would say, completely put the pandemic behind us, but things are really moving back into a more normal. And I would suspect that we'll probably be hearing from some more clients that have had pushback from the FDA in the near future. That's just an industry shift to try and move to more reliable, more sophisticated, more sensitive type of test methods. And so we would recommend switching and following the guidance that's in USP 1207 to use deterministic methods.
Great. Thank you both so much. We are officially out of time. I want to thank the audience for joining us and participating. I'd also like to thank Nelson Labs for sponsoring today's event. For our audience, before you go, please consider participating in a brief survey. You can see the survey to the right of your screen. You'll receive an email alerting you when this webcast will be available for replay. Feel free to forward that email to your colleagues who'd be interested in tuning in and may have missed today's event. Thank you to everyone for joining, and we will see you next time.